New concerns from health experts tonight. The Arkansas Department of Health reported 77 COVID-19 related deaths across the state last week. But here in Jonesboro, hospitals are not seeing as many patients in critical care. Maddie Sexton is live at St. Bernard's tonight. And Maddie, what are doctors saying to you right now?
Yeah, Macy, well, that's 69 more COVID-related deaths than just the week before, but that's not necessarily the case here at St. Bernard's. While COVID death rates are rising in other parts of the state, in Jonesboro, St. Bernard's Medical Center reports less than 5 deaths from COVID since the start of January.
The majority of our patients that are coming into the hospital with COVID are not needing ICU care or critical care.
Vice President of Medical Affairs with St. Bernard's, Dr. Casey Holder, says the severity of the sickness is way lower than this time last year.
Now, that's not to say there aren't some. Certainly there are some that are really sick and have died.
Dr. Holder said in the early years of COVID, the variant is what made people feel really sick. But since the virus has mutated,
it's become less virulent, but it's easier to spread. So it's more contagious. And so we may see a lot more people with it potentially, but they're not as sick.
However, she said St. Bernard's COVID rates are higher than they were in January of 2023. Patients just aren't spending as much time in the hospital because of it.
You know, they come in, they need a little bit of oxygen support, or maybe they got dehydrated and they need some IV fluids. It's just not the way it used to be with COVID.
I spoke with Ty Jones at NEA Baptist, and he told me they're also in the same boat, with less than 5 patients who died from COVID-related illnesses since January 1st. Live in Jonesboro, Maddie Sexton. Back to you, Macy.
All right, thank you so much for that report tonight, Maddie. And the Arkansas Department of Health also reported 93 new hospitalizations last week. The state is also experiencing more flu cases with 43 hospitalizations total.